Senator Manchin.
Thank you, Senator, and thank you, Madam Chairman. Appreciate the consideration. And Secretary, thank you for being here. Appreciate it very much. Domestic manufacturing, I think you and I have talked about this before, need to supply our supply chains are not caught off guard again, especially for life-saving essential medication. I was pleased to see your department establish offices under the Assistant Secretary of Preparedness to better help build out the United States manufacturing industrial base and invest in long-term capabilities to better respond to emerging biological threats. Your budget request is $400 million, I think, to bolster the medical supply chain. But there's been about $10 billion that was approved for that before. Can you tell me if there's any money left from that we could apply to this, or how the $400 million will be spent?
Yeah. Senator, we've had discussions of this before. Most of that money was either went out the door or is on the verge of being obligated for services that are still related to COVID. In order for us to really increase our capacities with the domestic supply chain, we will need some resources, and that's where the President's budget does actually identify that as one of the things we would really like to do, because it's not just a matter of meeting our supply needs, it's also creating domestic manufacture of that product.
Second, I'm going to go into drugs right now. Senator Capito and I on the Jesse's, what we call Jesse's Law, Jesse Grubbs Legacy Act. I know you've heard us talk about this before. We passed that bill quite some time ago. It came in the CARES Act in 2020. I was pleased to see the department issue proposed regulations last fall. What is the department's timeline to implement the final rule of the Jesse Grubbs Legacy Act, this young girl who lost her life to drug overdose?
You're getting granular on me, Senator. Let me get back to you so I don't give you the wrong timeline on that.
Yeah, I hope it's quicker than what it's been.
I know you're hoping it's quicker, so we'll get back to you.
No, okay. The Lifeboat Act. Let me ask you this. You know, with the drugs that we have in the situation right now, we lost 106,000 Americans last year. Over the last 10 years, we've lost more Americans to drug overdoses, opiate addiction, than we have in any wars we've ever fought, all of them accumulated together. With that being said, it's time for us to take it, with the debt that we have, take a realistic approach. The Lifeboat Act simply says this: a penny per milligram for all manufacturers. If you think you need to put this much product in the market, then at least pay so we can use it, so we can get people cured, if you will. Every penny of this goes towards treatment centers. And treatment centers could be in every part of the country. I've been trying and trying and trying, and everyone, for whatever reason, we haven't had any success. Have you heard about this? I think you and I have talked about it. Does it make sense to you with a tight?
Anything that gets us the resources to catch up to this plague makes sense, because we're losing ground on occasion, and we need to get ahead of this. And so any way that we can try to figure out how to fund this would be instrumental in saving lives.
Would you all be able to support something such as that?
We certainly would take a close look, because you're trying to get resources, and we need resources to make it work.
Let me speak about PBMs then. Let's speak about PBMs, okay? PBMs, 80%, three companies, 80%. The amount of money that they receive and the way they're able to control and classify on drugs to the highest, sourcing the highest drug prices because they get a better rebate. How do we allow this to happen? How do we stop it?
Senator, you've been in this business for a while, and I was in this body as well. I think we know that there's some folks who are very clever and creative in how they do this work. Middlemen have always skimmed money off the top, and it's a matter of how we can try to keep the resources where they're most needed with consumers, not with middlemen.
Well, for the PBM, pharmaceutical benefit managers, they're basically middlemen right now. As we're reducing price, and finally, the Inflation Reduction Act, the amount of money that we were able to save by negotiating on certain drug prices, that money is being able to help bring down prices. Is being used directly for reducing the price. What more can we do if we expanded that? How much quicker can we do this?
Transparency would be very helpful to see how they're operating. And as you know, the difficulty here is that the moment we try to do something, we likely find ourselves in court. And so we're trying to move this dial, and we look forward to your help in that.
Okay. Back to the PBMs. The drug formularies, are they the ones that set the drug formularies?
Well, those formularies are worked out with CMS and others that we take comment from.
so they're not totally in control directly on that. Why are we getting so many of the higher price drugs approved on the market, basically for use other than the lower price or generics?
I don't know if you have the time to go into the specifics
Okay.
of that, but we can try to get back to you
I'd
on
love to get back with you on that one. PBMs is my number one concern about the high prices of drugs.
Look forward to working with you.
Okay.